How has bladder imaging evolved for cystogram analysis? Imagine how for bladder imaging has come over the past century. It's a story of technological breakthroughs that have transformed how doctors diagnose bladder issues, including bladder cancer. Let's explore this evolution step by step. It all started with the discovery of X-rays in the late 1800s. Early on, doctors used plain X-ray films of the abdomen, but these images didn't give a clear view of the bladder. To improve visualization, they developed cystography, which involves inserting contrast dye into the bladder through a catheter and taking X-ray images. This technique allowed doctors to see the shape and outline of the bladder and identify abnormalities like ruptures, diverticula, or tumors. For many years, conventional cystography was the main method used. It was effective but had limitations. It exposed patients to ionizing radiation, required catheterization, and only produced two-dimensional images. Despite these issues, it remained a key tool for diagnosing bladder trauma and congenital problems. Then came the second major shift in the latter half of the 20th century. Ultrasound, computed tomography, and magnetic resonance imaging entered the scene. Ultrasound is non-invasive, uses no radiation, and is affordable. It's often used for initial assessments, especially in children or for detecting stones and tumors. However, it can't always see the entire bladder or surrounding tissues clearly. That's where computed tomography and magnetic resonance imaging made a big difference. Computed tomography, especially when combined with cystography, provides detailed three-dimensional images. It involves filling the bladder with contrast dye and performing a Cort scan. This method can precisely show the extent and location of injuries or tumors, helping guide treatment decisions. It can distinguish between different types of bladder injuries, like ruptures inside or outside the abdomen, which is vital in emergencies. Magnetic resonance imaging offers excellent soft tissue contrast and is increasingly used to stage bladder cancer. It helps determine how deeply a tumor has invaded the bladder and nearby tissues, which is crucial for planning treatment. Today, the choice of imaging depends on the specific clinical question. For bladder trauma, Cort cystography has become the preferred method because it's fast, accurate, and can evaluate other abdominal organs at the same time. When it comes to bladder cancer, doctors often combine cystoscopy, which is a direct visual examination with a camera, with imaging tests like Cort urography or MRI. Cystoscopy remains the gold standard for detecting and monitoring bladder cancer because it allows direct visualization and biopsy of suspicious areas. Imaging complements this by helping assess how deep the tumor has invaded and whether it has spread beyond the bladder. Every imaging method has its benefits and risks. Conventional cystography and Cort involve radiation exposure, which is a consideration, especially if repeated scans are needed. MRI does not use radiation but tends to be more expensive and less available in some areas. Ultrasound is safe and accessible but less detailed for certain conditions. The ongoing research aims to improve these technologies further. Advances include reducing radiation doses in Cort scans, increasing MRI resolution, and developing functional imaging techniques that can provide biological information about tumors. These innovations could lead to even earlier detection and more precise treatment planning in the future. For anyone concerned about bladder health or bladder cancer, understanding these imaging options is important. Remember, no single test can provide all the answers. Doctors interpret imaging results alongside symptoms, medical history, and other tests to make the most accurate diagnosis. Always consult healthcare professionals for personalized advice. In summary, bladder imaging has evolved from simple X-ray films to sophisticated three-dimensional scans with Cort and MRI. These advancements have greatly improved our ability to diagnose injuries and cancers early, stage them accurately, and plan effective treatments. This progress is vital for improving bladder health outcomes and ensuring patients receive the best possible care.